The Ministry of Health shows that depression contributes to 10% of time off work by employees, with an average of 36 workdays lost per depression episode. Officials charged with the responsibility of staff management policies in the civil service have been urged to consider the impact of policies will have on the well-being of affected staff during implementation.
As you all know, mental health is a global challenge. The statistics that we read there from WTO is that you have over close to 1 million people globally who kill themselves through suicide because of depression, and several others who are abusing drug and etc. About 264 million people globally with one form or other of mental health. So governments have to step in and intervene. And of cases of public servants who may be experiencing issues and challenges with mental health. And why are we doing this intervention? We are doing this intervention because we have realized that there are increasing cases of mental illness in public service. We have several cases or many cases of people with problems of drug abuse, alcohol, some members of staff who are depressed. And this happened so much even after COVID-19.
The Principal Secretary in the State Department of Public Service, Mary Kimonye, says that implementing officers need to think about the effects, such as policies, as delocalizing management transfers and disciplinary procedures have on the mental being of the staff.
And the end result of that was that many of them were depressed. So this is an intervention in itself, because we are going to train them on essential counseling skills, life skills, mentorship, early detection, so that they can become of help to their colleagues. So basically this is why we are here.
The implementation of policy needed to have a human face since it had an effect on the officer's family. Care should be taken to ensure officers are not left stressed when policy is implemented.
The standards that the school expects have been adhered to, because again we are producing mental health champions that are going to nurture people, not objects, and we are very careful about that. So we are really proud, madam, for this group, because we are at a level whereby Kenya Mental Health Action Plan dictates that we need to establish wellness programs in our workplace.
Mary Kimonye was speaking at the Embu campus, where she officially opened a 2-week counseling skill course attended by human resources officers from ministries, department agencies, and county governments.
We have a good number of public servants who are one form or another. Remember, it is a whole range. It's a whole range. Either you are drinking too much, or you have drug issues, you are coming to work late, you are depressed, you have anxiety. All these, we identify them as mental health. You are showing signs of isolation, you are non-communicative. So it is, and by the way, each one of us could be suffering one form or another, even as we are standing here, all of us. Yeah, so this is why we are doing this. Across the ministries, we've already trained 302 mental health champions. Now this is another cohort of 30, and we progressively continue to train them. We have given them a tool which they will use for detecting this mental health and reporting to.
This is the 4th cohort in the program that has seen some 302 human resource officers trained in basic counseling skills that they can use to help staff going through difficult times. She observed that the World Health Organization report indicated that 264 million people suffer from depression globally, leading to about 800,000 deaths annually. A survey jointly released by Institute of Human Resource Management and Chiromo Mental Health Hospital showed that more than 70% of workers in various segments of the public and private labor force have never been screened for depression, and not from a qualified mental health specialist. Many of these people in middle and low income countries did not get the right medical care for their condition due to insufficiency trained medical workers, high social stigma, and inaccurate diagnosis. The PS said that the mental disorders, when left unattended, were responsible for the increased cases of homicide, suicide and murder of spouses among government workers. For Embu TV, Amode Francis.